Hello, this is Breastfeeding Brilliance, the benefits of breastfeeding programs and education by Zane Washington. Background. Breastfeeding is widely known as the optimal method of infant feeding, providing numerous health benefits for both the mother and child. As we know, healthcare professionals are extremely involved in delivery and care of both parties. They play a huge role in the support and promoting of breastfeeding, but most of the general population doesn't realize they face their own barriers and challenges when trying to do just that. This can result from a lack of experience or knowledge. These barriers and challenges can cause the outcomes of birth and the health of both mother and infant to suffer as a result. This literature review focuses on the benefits of both programs and education and what implications can be taken from these works of literature. The first study I selected was Breastfeeding and Human Lactation, Education and Curricular Issues for Pediatric Nurse Practitioners. This dealt with the breastfeeding and lactation education and pediatric nurse practitioner master level programs. Methods included sending an online survey about breastfeeding and human lactation education offered in the programs was sent to all PNP programs in the US, which was a total of 84 programs. The study had limitations. It had a tiny response rate of 42.9%, making it difficult to make a broad statement about PMPs everywhere. And it also had a potential for response bias. Findings of the study showed that all programs promote breastfeeding and teach strategies for breastfeeding, but not all programs taught the anatomy and physiology of human lactation. Respondents also indicated that curriculums included the promotion of breastfeeding, but only 18.2% of the programs offered opportunities to counsel mothers on infant feeding choices or teach actual technique. It was recommended that PNP programs should incorporate breastfeeding and lactation content into core courses, and encourage students to take online education courses and continuing education credits. In all, although PNPs believe that breastfeeding is an important use of their clinical time, the evidence-based breastfeeding and lactation education offered in the PNP programs was inconsistent. It was thought that formal incorporation of research-based lactation education and experience into the PNP curriculum would help students increase their knowledge and ensure better health outcomes for children. The second work of literature I reviewed was the use of web-based education program improves nurses' knowledge of breastfeeding. This article dealt with nurses, nursing students, midwives, and nurse practitioners who completed Breastfeeding Basics, which is an online educational program. A total of 7,570 healthcare professionals and students participated, with each participant completing either one pre-test or post-test for the online program. The online program itself was created for mostly created mostly for pediatric or other medical residency programs, but nurses and nursing students have been the largest group utilizing this program. The research mentions that personal experience is the top priority when it comes to breastfeeding, but it is typically not enough to counsel women on complex breastfeeding problems. This kind of was supported through this whole work of literature, that although knowledge may not be where it's at, increasing that knowledge will ultimately increase better health outcomes for infants. In discussion, breastfeeding basics is a has been found to significantly increase knowledge in all areas of breastfeeding. The program itself addressed the lack of breastfeeding education in nursing curriculums, and that it can improve the practice of nurses working with mothers and infants. Like I just mentioned, it was concluded that personal breastfeeding experience is not enough to provide comprehensive knowledge, and the program helps standardize nurses' knowledge based on evidence, not just experience. The program should be combined, it's recommended that the program should be combined with hands-on training to improve skills and ensure effective support for breastfeeding mothers. The next article was about doula care and how it supported breastfeeding initiation among diverse low-income women. According to the article, association between doula care and breastfeeding initiation rates among low-income Medicaid recipients was increased because of doula care. This study was done on Everyday Miracles, a Minnesota-based organization that employs doulas, which I did not know, but doulas are, I guess you could say, care support workers that assist in comforting first time mothers, not even first time mothers, but all mothers who just given birth, which I did not know before doing this research. They compared 1,069 women with doula care to state-based sample of women with Medicaid coverage who gave birth from 2009 to 2010, which was a large number. Results. Almost all mothers who received assistance from a doula during birth began breastfeeding 97.3% of the time, while only 80% of the general population did. In the African American community specifically, 92.7% with doula support initiated breastfeeding compared to 70% of the general population, which you can see both showed a very significant increase compared to the population without doula support. These results support that having a doula during childbirth could lead to a better chance of breastfeeding, thus leading to better health benefits associated with breastfeeding for both mother and infant. I think this article was very important in discussion because although this is focused on the education of healthcare professionals and how they can increase their education on breastfeeding, sometimes other areas can be promoted or advocated for to start to get mothers to breastfeed, and in this case, doula care seems to point in that direction that this is something that should be advocated for mothers to experience in the hopes that they might want or plan to breastfeed in the future. The impact of formal breastfeeding education program. This article wanted to find whether a formal educational program for breastfeeding would have an impact on knowledge, comfort level, and feelings towards breastfeeding on healthcare providers. They surveyed doctors, nurses, and some new moms about breastfeeding before and after starting the formal education program to see if the program changed how the moms breastfed, the frequency, if it was exclusive, and the differences in nighttime feedings. Here's some of the results. The knowledge scores increased from 20.2 to 22.2. The comfort level scores increased from 20.7 to 29.4. There was no significant change in attitudes towards breastfeeding. Exclusive breastfeeding increased from 55% to 63%. Nurse observation increased from 84% to 92%. Nighttime breastfeeding increased from 55% to 71%. This study was kind of eye-opening. As I mentioned at the beginning, they said breastfeeding, of course, is optimal for infants for the benefits, but it said 35% of breastfeeding mothers in New Jersey are exclusively breastfeeding at the time of hospital discharge, and only 20 to 30% are exclusively feeding nursing 6 months later. So the study was almost focusing on if the impact of the formal breastfeeding educational program would help, which in their case, in the studies that they researched, showed that training physicians about breastfeeding can improve breastfeeding rates. Training also increases the physician's knowledge and confidence with breastfeeding issues and increases breastfeeding supportive nursing behaviors, which is ultimately the goal when trying to increase your education on a topic. Breastfeeding education, empowering future healthcare providers. This article explained how a Missouri team created an online breastfeeding educational modules for nursing and medical students. This is a quote from the article, the reported extent to which the healthcare provider impacts a mother, regardless of her feeding decision, is consistently secondary to the influence of the father, the infant's maternal grandmother, or friends. This quote was a big kind of how it started off, so it's kind of eye-opening when you really think about it. Most people would think that somebody would go to the person of the highest education on the topic, but that's not always the case when it comes to decisions involving family or your kids. The article concluded that women often turn to public media for information on infant feeding. And they also concluded that to promote breastfeeding in the most effective way, a plan to address what women hear from healthcare providers, social circles, and information on the media must be taken. In their study, nursing and medical students who participated in the online education were better equipped to communicate its benefits and assist mothers in clinical settings. Now, going back to the mothers being influenced by other sources of information, the article also hinted on how breastfeeding is the preferred infant feeding method, backed by many professional healthcare organizations. However, it stated the United States fell short of achieving the goals set by Healthy People 2000 and Healthy People 2010 for breastfeeding rates. This research was the second article that I had found on a doula-based program. This one was in a hospital and dealt with the childbirth outcomes in an urban multicultural setting. The study was focused on whether a hospital-based doula program created different outcomes for women during birth and breastfeeding compared to those who didn't. I have a definition of doula right there because it's again something that I hadn't come across in all of my research or educational experiences. They conducted a retrospective program to compare differences with birth at 37 weeks or greater with doula support compared to those without doula support. They compared cesarean deliveries, epidural use, and operative vaginal deliveries. The results supported that women with birth sisters were significantly more likely to intend to breastfeed and to initiate breastfeeding in the immediate postpartum period. There were no differences in primary cesarean deliveries, epidural rates, operative vaginal deliveries, or APGAR scores. This study did have some limitations, as they had a possibility of bias in the experimental group. They had an inability to control some variables, such as medical risk factors, the presence of family and friends, in addition to the doula support, and labor preparation practices. In all, the program showed that doula support, or if you want to reword it in a different way, social support, is an important component of care for women who are giving birth. Again, this is something that healthcare professionals might want to advocate for, as far as having these programs in place where there's a mother giving birth, in order to promote better initiations of breastfeeding and increasing better health outcomes for the mother and infant. This study focused on the effects of prenatal breastfeeding workshop on breastfeeding self-efficacy and duration. This was a randomized controlled trial. It included 110 first-time mothers that expected a single child, uncomplicated birth, and were planning to breastfeed already. 92 ended up being in the actual research. They were assigned to either control or the workshop group. The intervention was a 2.5 hour prenatal breastfeeding workshop. This study did have limits. Well, the results were limited by participation bias because the participants were self-selected, meaning they were selected on the fact that they were planning on breastfeeding beforehand. More than like this was paraphrase. So more than likely, participants were more likely to breastfeed or were already confident about breastfeeding because, like I said, they were selected based on their planning of breastfeeding in the future. So general conclusions can't be placed on the general population because, like I said, they were selected based on the fact that they were already planning on breastfeeding before birth. The study showed also that the timing of the first feeding and the amount of formula used were inversely related to the duration of breastfeeding, and that those who missed more than one workshop had weaned by the end of the study. This article was in about breastfeeding basics, which I had mentioned earlier in a different review of literature, that they use the same online educational program to see how it improved. I believe it was nurses in the other article. But this one was focused more on how to improve breastfeeding knowledge of maternal child healthcare providers. Breastfeeding rates in the U.S. fall short of Surgeon General's Healthy People 2010 objectives. Maternal child healthcare providers, including physicians, residents, have been proven to enhance initiation and duration of breastfeeding. They had a computer scored pre-test and post-test. 3,456 maternal child healthcare providers were participating in this study, and 65% completed one or more pre-tests. These were the average scores before and after the online course. Mid-level providers 81% to 89%, residents 84% to 93%, physicians 85% to 92%. Other results, topics with lowest initial score and significant improvement after course included supplementation of vitamin D, breastfeeding physiology, growth of breastfed infants, and cessation of breastfeeding. The barriers or lack of knowledge that I mentioned in the background of breastfeeding education and programs, and how healthcare providers lack that knowledge or experience most times in most cases, were all supported by almost every article that I researched. This is where I think these educational programs and training that most of the articles speak about come into play. They increase not only the healthcare professionals' competence, but also the quality of care and information passed on to the mothers in order to create better outcomes. Even in the cases where education may be lacking, the option of advocating for doula care, which was mentioned in two of the articles, seemed to greatly impact the acceptance and willingness of mothers to breastfeed. In conclusion, doula care may be an option for healthcare professionals to advocate for to promote breastfeeding. Training programs and educational programs for breastfeeding seem to be a promising option that hasn't been implemented in the most effective way all the time, or as it should have been from the beginning. Professional healthcare workers should always strive to increase their knowledge through educational programs in order to provide better support for breastfeeding mothers and infants. More studies are definitely required in order to make broad statements on the benefits of breastfeeding education and programs. But from all the reviewed literature, we can see a small glimpse of what possibilities can come from educational programs for healthcare professionals. And thank you.